Good afternoon, everyone. I'm honored to be here today amongst intelligent and amazing people trying to revolutionize the industry. My name is Dr. Sima Yakoby Epstein. I went to University of Pennsylvania for dental school. I then did a residency at Cornell Presbyterian. I taught at NYU Advanced Aesthetic Dentistry for 2 years, worked as a cosmetic dentist, and then went back to UPenn for orthodontic school under Dr. Van Arsdale, and then worked as an orthodontist in New York City for 10 years. I have an advisory board of a significant KOL in the industry, as well as some important people that help with business development and healthcare suite professionals that are also a part of many different universities. I think the Orthonu standard exemplifies what is happening in the industry with all the technology, the artificial intelligence, and the remote monitoring, trying to optimize and scale practices. There's one missing component that Orthonu gives, and that is keeping patients at home with research and science-driven products that help the patient be comfortable and really complete the puzzle of being able to scale and be efficient in every single practice globally. So you see a lot of different products when you go down the aisles of CVS and Walgreens. Many of them look all the same with the same ingredients with different colors, but there's really nothing for the orthodontic patient in pain. And that is where Orthonu comes in. So this was a market research study done with patients in braces, over 300 of them. And if you look at the self-reported issues that are completely missed in practices, is that these patients are in pain. They're having problems sleeping, they're having problems with mucositis, with ulcerations and irritations, and these are things that have never really been treated before in practices. So I created these oral relief collections, and all 4 of these products are interchangeable between a patient in braces or aligners. They're all anti-inflammatory, antibacterial, antimicrobial, and really help the patient to feel comfortable and keep them at home. So the first one, Chillin Strips, it basically replaces silicone wax. It's the first ever dissolvable strip that lasts for over 2 hours. You can mold it anywhere into a extraction site, exposed wire, a palatal injury, inflamed gums, and again, the adhesion activates with saliva, so it's pretty remarkable in terms of wound care. We have a 72-hour strip as well that we are developing in order to be able to help the oral surgeons and periodontists as well as the ENT. We also have the mouth aid, which essentially you have patients walking in with canker sores, cold sores, buccal mucositis, oral herpes. These are children in a lot of pain that go to school every day with these, and they have nothing, but now they have mouth aid. This is something that is very soothing and healing instantly. They can use it as many times a day as they want throughout treatment, and it really helps, especially with the proprietary shape and soothing ingredients, to be able to be used throughout treatment and really anyone with a mouth. Then we have Comfort Tape, which is essentially a Band-Aid for teeth and gums. There's a lot of inflammation and sensitivity of teeth throughout treatment, and this is something that targets that, especially for patients even in retainers, under mouth guards, wearing aligners or braces. Really, this is something that goes onto the gum line. You can see in the picture that this is where all the irritation is coming from, so it soothes the inflammation of the gums. The perforated lines go over the aligner attachments or the brackets themselves and then go underneath onto the tooth. So what it does is it prevents any ulcerations on the inside of the lip or the buccal cavity, as well as protecting the teeth from sensitivity. Again, this is used throughout treatment as many times as they want, and this is something that really benefits the patient. Lastly, we have the ever so popular Ortho Chews, which replaces silicone chewies. As we know, silicone harbors a lot of bacteria, and it's something that's very hard to chew on. So I have created this dissolvable chew, first ever, that really helps with dry mouth, with discomfort. You can use it if you are a patient in braces or aligners, and it really does soothe all of the different types of pain points that you have during treatment. Obviously, everyone knows the Leatherman of orthodontics, tweaks for braces and aligners. And this Orthonu Complete Oral Relief Collection really solves the problem for practices and patients. And essentially, it elevates the patient comfort by having products that have never been done before in the industry. Again, eliminating the idea that having toothbrush and floss and toothpaste is going to help the patient. Now you actually have products that patients can utilize throughout treatment. It's a seamless integration into practices by being able to incorporate it as a starter kit, as a treatment fee at cost neutral, or increasing the price to gain a little bit of revenue stream and increasing EBITDA in the practices. And it's an incredible partnership for integration into any business, DSO, and distributor. So testimonials, we have Maria Ryan from Colgate, who loved these kits, not only for orthodontics, but for other specialties as well, which is the vehicle that these products allow for. We also have the integration into practices. You can see here people from all over the US, including the UK and EU, are using them, and patients are really loving them and ordering more as they continue out throughout treatment. Our total addressable market just for the products that I have in the pipeline, which is again the Oral Relief Collection and other ones to follow, is $7 billion. Our global market size opportunity again includes orthodontics, wound care, and oral health, which is over $66 billion. We have over 26 patents pending. I have 8 patents allowed and 4 products ready to release, as well as 6 products currently on the market. Our B2B distribution strategy, again, is going to the DSOs and the OSOs, or dental supply distributors. They go ahead and sell it to orthodontic and dental practices. They incorporate it as a treatment fee in the starter kits, and then it goes to the patient and consumer. Why this is so valuable? Because it basically has 3 verticals which continue to rotate with the consumables, giving the opportunity for revenue share to practices. While the patient gets it in the first starter kit, they're able to order these throughout their treatment as well and share that revenue with the distributor, with the DSO, or the practice themselves. This is just an example sales scenario, distribution roadmap. Again, continuing to focus on these channels, really being able to develop the B2B into the B2B2C and D2C. This is our take to market long term. Again, orthodontic, dental office, retail, and the current raise, we have at a 15 million valuation, we're raising 1.5 million with a 5 to 7 year exit acquisition at 7x plus valuation. Our current raise and distribution of funds is going to be used mostly for cost of goods, trying to really decrease those margins, increase those margins, decrease the cost of goods, being able to scale, create an infrastructure with certain C-suite executives that can really help us scale globally. Thank you.
Okay, panelists, let's ask away.
Thank you. Are you working with any DSOs or OSOs to date, and what are your sales like?
Yes, so we are currently working with several DSOs. Some are in a process of trials, some are in process of developing our sales. We launched tweaks for braces and aligners in 2023. And we just launched this past May the 4 oral relief kits. We're about 150,000 in sales, but again, B2B is a long sales cycle. So we have about 5 or 6 different companies that have purchase orders, and also we have major distribution potential in the UK as well as Italy.
Are all the products bundled, and would you give the DSO the opportunity to white label this bundle?
Yes, absolutely. You see on the left here is an Orthonu box. Again, this is a bit big, but essentially can be bundled any way you wish. Each patient, whether they're in braces or aligners, can have a tweaks for braces or aligners with the 4 oral relief kits. Any DSO is able to market their practice or their doctor's practice onto the boxes, and being able to use them for their DSOs as a white label as well.
You mentioned the words, I think, anti-inflammatory. What type of active ingredients are you consider? Do you have any FDA approvals here?
Yes, so the 4 oral leaf products, 2 of them are class 1 medical devices, 510(k) exempt. We are able to sell through globally. The other 2 are non-classified. The anti-inflammatory parts are the natural ingredients such as dead sea salt, menthol, peppermint oil, coconut oil, all of these that have been worked on significantly to be able to create those natural anti-inflammatory effects, as well as some proprietary ingredients.
Thank you.
What are you looking for from this panel or coming out of here today?
I'm really looking for strategic partners that love the products, that know the impact it can make on every single practice, and being able to help me to scale this into the right categories, the right universities, the right practices, and globally.
Can you talk about your estimates? So over the course of an orthodontic treatment, how many, if someone is a sufferer from pain or whatever it is, what's your estimate on how much of this product they'll use?
Yeah, great question. So essentially, when you start out with the treatment starter kit, what it does is it potentially provides the patient throughout the first couple of weeks, which is the highest pain points, for a patient to understand what products they'll need. And because the life cycle of a treatment is 2 to 3 years, it could be anywhere from 25 to 50 to 60 pouches over the course of 3 years, based on every appointment, every wire change, any type of adjustment that causes that whole wound process all over again. So I think the potential for this to be included into phase 1, phase 2, all different specialties of dentistry is creating a huge vehicle for all patient kits to be able to use, and they can use it as many times as they want. So it really depends on the patient, but it could be 1, it could be 50, it could be any number in between based on their comfort level.
One last question, with DSO and OSO partnerships, in terms of shipping, are they mainly ordering bulk shipments and then providing to their own patients, or are you dealing with operations and all of the logistics there?
So the ones that we've dealt with recently, we bulk ship to them, and they coordinate it with their offices, and they essentially divvy it up into the practices that they're doing it based on their treatment starts. But there's obviously potential for all different types of operational, depending on the amount and the MOQs.
And can you talk about the margin, the average margin on that bundle?
Yes, so it's about a 50 to 60% margin to the company, and for the doctors, they obviously can make as much margin as they want. If they want to incorporate the treatment fee, an extra 10%, 15%. I think that the patient is very happy to receive such a beautiful oral relief collection, and that is something that they can do based on their practice business model.
So what would that sell for?
So for me to sell to a practice, if it was just the oral relief kits, just the 4 of them, it would be $24 to the doctor. So MSRP to the patient would be $34.99 for those 4 kits. And then if it was the tweaks for braces and aligners with the combination, we give it in a beautiful white box, and that's $65 to the practice, and they can incorporate that into their treatment fee.
And you mentioned on there going through distribution as well. Do you have margin in there built in for distribution?
Yes, we do. We have margins built in for distribution, not only in the US, but also UK, EU, and Australia.
Okay. Thank you.
Thank you so much.